What's up, everybody? Good morning, good morning, good morning. Aloha, aloha. Happy Hump Day, Wednesday. Appreciate you guys joining us tonight. We got a blockbuster show tonight, guys. We had what a day. What a day. Let's just start off with what a day. It's a long day in many ways, but as it relates to our discussion tonight, the weekly numbers came out. You guys all saw the weekly numbers. I'll be posting it up real quick in a little bit. We got Dr. Tim Brown and Dr. Lee Altenberg, two of Hawaii's many leaders as it relates to COVID and health. So I'm excited. I am excited to have those two gentlemen on the screen tonight. A lot of questions. I think some of you may have seen Dr. Tim Brown on the news this morning. Dr. Lee Altenberg, these two gentlemen have really hold on here. Let me just take care of this thing real quick. Yeah. What am I doing here? All right. These two guys have basically their projections have been spot on from day one. They've been calling this crisis, this pandemic, pretty doggone accurately for over 2 years, going on 3 years. So I'm excited to hear and get their insights tonight. I got a lot of questions, and I think many of you have questions. Again, I'm solo tonight, so uh, I ask for your patience and understanding as it relates to comments. I'm trying to keep track of comments and making sure that the stream is working fine. So appreciate all of you folks, man. I was thinking today. I was at work today, and I had to go to the Waimea Pier to interview a couple of witnesses, and I was sitting out before we did the interviews and just looking outside. We walked the pier. My partner and I walked the pier and just appreciated. I hadn't been on a pier for so long. The ocean outside of the pier was flat, uh, and it was just I had not done that in a long time, and it just made me appreciate living here on Kauai or in Hawaii, where we can go. We're so close to the beaches, and we're just so close to peaceful, paradise, really. and and I was out there when the report came out um, about the numbers, and it kind of spoiled it for a little bit. And then again, I took a look out at the ocean, and I just realized, you know what, man? We're just happy to be alive. We're happy to be here, and we're so thankful that that we live here in paradise. So. Considering all that's going on or has been going on, I mean, if you watch the news, it's you got, of course, we all know the mask mandates for air travel got lifted yesterday. If you follow the alerts that come out from all these different um, news sources, the first report came out that the Department of Justice was going to appeal the ruling, and then it came out, well, they're not going to appeal unless the CDC says that masks are say are that we need to use masks. And then today, of course, it was final that the CDC did make the ruling that masks should be worn. So now the Department of Justice again are going to file an appeal. I have no doubt. Again, this is a non-legal opinion, but I would think that the it'll be very difficult for the Supreme Court to rule that masks don't prevent the spread of COVID in airplanes. So, but then again, we run into the big problem of the confusion, right? Because if it gets overturned, and I just visualize a lot of lawsuits being filed. But the bottom line is this: this pandemic is not over. This pandemic, as we saw by Hawaii's numbers today, and we'll put it up on the screen a little bit and have the doctors give us their assessments. But we see what is happening is exactly what we in this village knew would happen, right? It doesn't. You don't have to be a doctor. You don't have to be a scientist. You don't have to be an epidemiologist to know the trends, right? We see it happening around the world. We see it happening in other states. We know that our borders are basically wide open, and with the lifting of the mask mandate, we knew what was going to happen, and it's happening. Dr. Tim Brown and Dr. Lee Altenberg both predicted that this would happen. I think all of our medical experts have warned and cautioned us. So while I'm not surprised, I'm pretty disappointed. And again, what have you heard? What have you heard from our leaders? Did the governor come out and say anything? No, no. Did the lieutenant governor? He's too busy on the sidewalks holding signs with his medical garb on. Have you heard anybody come forward? Any of our elected officials come forward and share with us the numbers? Have you heard the Department of Health, Dr. Char, come up and talk about the surge? I mean, I would think they're concerned. 17 deaths in the last week. Like, what is that just okay? Is again, I keep saying, is this the acceptable cost or price for freedom so that we can take off our masks and run around like nothing is going wrong, that the pandemic is gone? No, I mean, no, man, that's not an acceptable level. And it's going to continue to increase. And yet not one peep, none from our elected officials. No one seems to care. Or they are so wound up in their political campaigns that they don't want to upset anybody, right? You had a whole bunch of people across the state protesting the masks in schools. Today I was thinking, imagine if I was on a plane coming from the mainland, making the decision to travel because of the mask mandate in planes. And let's just say I had a 4-year-old and a 2-year-old traveling with us, and we're on the plane, and mid-flight they tell everybody, hey, take off your masks, it's over, and the plane cheers, everybody rips off the masks. I saw videos of the flight attendants coming down with the trash bags, people tossing their masks in the trash bags. Imagine that parent that has an unvaccinated 4-year-old and 2-year-old has absolutely no choice but to subject their children to potential infection from COVID because all of the people in the plane did not have to wear a mask. I mean, again, I shared this on Monday night. There was no leeway. There was no head start. It was just in mid-flight, guys. I would have been pissed. If I was a passenger on that plane, I would have been pissed. And because I got on that flight knowing that it was going to be a somewhat protected flight because everybody was required to wear a mask. Mid-flight, masks come off, virus spreading, and I cannot do a thing about it. I can wear my mask, of course, I can wear my mask, but we know how that goes, right? I'm not going to have that argument about masks don't work. That's a foolish argument. I just cannot believe people even post that. I mean, I see it all the time. I get private messages from people showing me that masks don't work. Well, whatever. That's simply not true. A mask's not 100%. I'm not saying that they work 100%. Hey, what's up, Pops? What's up, Pops? Oh, man, it was nice. Last night we took my dad over to Wong's. Charlie popped in on his way home from work. We had our cousins, my dad's cousins, that he hadn't seen in a long, long time. We had them surprise him. It was just a very, very, our very small group of people that were able to share, and it was quite a wonderful evening. And then it was a pre-birthday for my dad. His birthday is on Sunday, but we wanted to get him in front of his cousins again, like that he had not seen for so long. So anyway, back to the topic. Yeah, so you're on a plane, and halfway through, now you're subject to virus because some of the passengers are cheering. They were cheering, all so excited that they no longer had to wear a mask. And I would be very, very, very upset if that had happened. All right, first out of the chute, Dr. Lee Altenberg. Long time no see, my friend.
Great to see you.
The same here, my friend. I am so excited tonight. We got you and Dr. Tim Brown. Dr. Brown should be on in a minute or so. A lot of developments in the last week or so, more specifically the last few days. Again, the numbers report came out today, Doc, and once we get Dr. Brown on, we'll start off. I'll put up the chart. I'll put up the graphic, and I kind of wanted to get both of your insights on what the numbers are telling us. What are the numbers telling us as it relates to this new surge this new variant, the BA2, and should we be concerned? Obviously, again, it's kind of like preaching to the choir because our villagers have really followed you and Dr. Brown and Dr. Miskovich and Dr. O'Carroll and all of the wonderful doctors that have taken their time, Dr. Kaohi and Dr. Capono, and so we're not surprised because we were informed by all of you of what was to come, and lo and behold, again, not surprisingly, but quite frustrating is the fact that now we have to deal with this new surge and the fact that immunity is waning and restrictions are being lifted. So I think it's a horrible, dangerous recipe. So let's just start. Let me, Doc. I'm gonna put up the numbers, the today's report, and while we're waiting for Dr. Tim Brown, we'll get you. Oh, there he is. Dr. Brown is on. Hang on, Doc. We'll get you in here. All right. Let me just take this off real quick so we can properly. Oops, what did I just do? So we can properly welcome Dr. Tim Brown.
Hey, Mel.
What's
How
up?
you doing? Hey, Lee.
We got two of Hawaii's experts. I mean, I'm like tickled. So let's get started. I'm going to put up the screen the numbers that was released today. I think what is concerning for me, obviously, is the increase in numbers. Uh, the average, based on today's numbers, again, these are just cases that are reported. The tests are recorded and reported. This is not counting home tests. But based on the numbers, 1736, that equates to 248 cases a day statewide. Majority of that is in Oahu. 17 deaths, which is almost 2.5 a day over the last 7 days. But what I'm concerned, Doc, and this is we'll start with you, Dr. Altenberg, on your assessment of these numbers, and then we'll get into the mask mandates and so forth, the lifting of the mask mandates. But look at the positivity rating or the positivity rates for Kauai. I'm biased because I'm here. 12.5%. Hawaii County 5.8%. Honolulu is at 8.1%, and Maui is at 5.4%. So, Dr. Altenberg, let's just start with you. What do you see? What
Well,
do
if you
you
look
see?
if you look at the positivity numbers,
I'm going to leave it up. Go ahead.
if you look at the positivity numbers during the last 40 days, they show a doubling time of 17 days. All right, so they're doubling in percentage of tests, reported tests that are positive every 17 days. And what's unusual is that the case numbers, the reported cases, they're also going up, and they're doubling about every 26 days. And in the past, those doubling times have been in lockstep throughout the pandemic. And now they've pulled apart. And this needs some explanation. And maybe Dr. Brown, who I'm honored to be on the same show with, will have some explanation for that. It most certainly involves the home tests, because a lot of people are taking tests at home and not getting reported to the Department of Health. And it may be that the people that are getting reported to the Department of Health, they tested positive at home and then they went to get a PCR test. And that would enrich the positivity rate without boosting the case rate. But there is something curious with the data. And now there's an added wrinkle to that, which is that free testing has stopped. The free public testing has stopped because the state has run out of money from the federal government for that testing, because the federal government hasn't approved any more pandemic expenditures. So our ability to monitor what's going on is going to get even more impacted going forward.
Dr. Brown, I saw you on the news this morning,
Oh, was I
and
there?
yeah, you was there, and it's interesting because you're like you seem a little happy tonight, Jogly. You're smiling, but this morning, man, you had a little different face on. And what's your assessment of what was reported today?
Not good. I think that we are seeing a significant rise. That positivity rate is extremely worrying. Uh, I think that, a lot of that divergence between what's going on with the cases and what's going on with the positivity, I would tend to attribute to just the decrease in testing over time. I think, can I share my screen? 1 second.
Yes, sir. Yes, sir.
Let me see if I can, let's see, it only gives me a full screen option. Okay. So I'll share this screen. Sucker up. Okay, let me try this. See how this works. Can you guys see that?
Yep.
Okay, this is actually what's been going on with the testing in the state in terms of what's reported in the system. And you'll notice that basically through early March and through most of February, we're looking at about 8,000 tests a day, and we're fairly flat at that level. And in fact, if you go back to before our Omicron surge, that 8,000 number is more or less the number of tests per day that we've been doing for the last several years, or not several years, last couple of years. And then that started in early March basically to drop very rapidly. And now we're seeing it down to just under 3,000 tests per day. So I think, a lot of, that explains a lot of the discrepancy, I think, between what's going on with the positivity rate and what's going on with the case rate. Because the testing numbers are dropping so radically, basically the cases are underestimating the trend in what's going on. And in fact, if you then multiply it by almost a factor of 3, you would get back up to a case number that represented where we were when we were testing about 8,000 people a day. Now, I think the positivity rate itself is probably not a bad indicator. I mean, there could be some biases there in terms of, only the sicker people tend to go in and get tested. But in practice, I suspect that the trend in the positivity rate is much more stable and much more realistic than the trend in the cases because of this rapid change in the testing numbers. So, that's what tends me to lean toward believing that the positivity rate is what we should be looking at. And my concern with the positivity rate is just, well, let me share that screen again real quick. Run to one of the other slides here. Okay, this is just this is the rate for Honolulu. Okay, and you can see we've actually come into somewhat of an acceleration in the last several days compared to what it was doing for the last couple of weeks. It would not shock me if this is related to the more recent introduction of XE. Again, remember our surveillance data is, or I should say our variant data is at least 2 weeks, maybe even 3 weeks out of date. There is a new variant coming out of New York, which is definitely contributing to the acceleration of cases in New York State. BA 2.12.1. And that is what is driving the epidemic in New York right now. It's about 50% of all cases in New York, up from very, very low numbers just a couple of weeks ago. It is now 20%, 19% of cases in the United States. I would not be shocked to see it already here, and that could be driving somewhat of an acceleration. I am concerned that this upward trend is a real trend, I think. And we are seeing an increasing pandemic here. A lot of people have stopped using their mask. I think the invisibility of the epidemic, because the DOH releases numbers once a week. And, what people tend to focus on is the case numbers, which look so comparatively flat without taking into account how the testing numbers have declined over time. And this positivity rate is very concerning because if you look at that, I mean, by next week, we're probably going to be at least 10 or 11%. And that's getting us almost halfway to the peak of the last wave in terms of, positivity rate. So, to me, this is cause for great concern at this point because it means something is happening here. The media is not really paying much attention to it, giving it relatively limited coverage. And so people aren't even aware that this is going on, I think. And that's a real problem because we've told everybody take responsibility, make your own choices, et cetera, et cetera. But the bottom line is if we're no longer, telling them that there's anything to worry about it there, they're not going to make any choices because they have no choices to make. And they'll just continue to do things that potentially spread COVID further. And that's what I really worry about.
And I think you bring up a good point because it was this afternoon when I came back to the office and I was talking to one of my coworkers. They didn't know about the increase in numbers. But what's intriguing is at one point we were doing about 12,000 tests per day. And then we were like you said, flattened at about 8,000, and we're now at about just under 3,000 or 2,500. So what you're saying is that if the numbers today, let me get my chart here, is 1,700, and if we had been testing at the 8,000 tests per day number, we could be looking at our cases could be at about the 4,000 or even higher.
For a week, yes.
In the last week. Yeah, well, that's kind of scary. You mentioned about the positivity rate jumping to 10 or 11% in a week for Oahu. I think you saw the chart. Kauai is already at 12.
Yeah, you guys are way ahead of us. I mean, come on. I don't know where you guys got that jump start. I mean, you were actually relatively flat a couple of weeks ago. Now it's like, whew.
Yeah, I mean, I think if you look proportionately, we have a problem here. I mean, it's a serious problem that infects the positivity rate, I think. But again, I'm not sure if you were on, I said, we have heard nothing, even since yesterday, when the mask mandates were lifted for transportation. Today, with this new report, we have heard nothing from our governor, our lieutenant governor, our Department of Health. We haven't heard a thing, and that creates a problem. Dr. Altenberg, should we be concerned, I guess is the question. Should we be concerned with this new surge and where it's heading?
Well, here's one perspective. So there was a story today about the mask mandate, and they quoted somebody saying the pandemic is over. Well, if you look at the latest daily case numbers, they're greater than the daily case numbers for 76% of the entire pandemic so far in Hawaii. All right, so it's like these case numbers are in the upper 25 percentile, the upper quarter, not the bottom. And that says to me that the pandemic is far from over. So just a perspective. So the numbers have come down so far from the peak of the Omicron surge that in relation to it, it seems small, but in relation to the entire pandemic, the case counts are greater than 76% of the case counts on all the other days since this pandemic started. So I don't know if that's helpful, but yeah.
Well, again, it's kind of scary, and I think because our people, as Dr. Brown mentioned, are not aware, and there's no effort to really make them aware. I see another chart, Doc. You want me to put that up?
Yeah, share my screen. I mean, one of the things that I always try to look at when I'm trying to figure out whether something is real in the data or not is I look at the trend across all of the islands. So this, in fact, shows you the 7-day average of the test positivity across each of the 4 major islands for which we can get the data. And you can see basically it's pretty much the same trend across all 4 islands. And that tells me that, we're dealing with something real here. We are seeing an increase that is occurring across the islands. Yeah, like I say, Kauai, you can see you guys were kind of flat there, like through early April, and then all of a sudden you just shot up. So I'm not sure exactly what's going on there. You guys really jumped. relative even faster than the other islands did. Maui was comparatively flat a couple weeks ago. Now again, showing that upward trend. So that tells me that something real is going on here, and I agree with you. I mean, it's problematic that our politicians, that our public, DOH is, running on silent. I mean, we haven't heard a word out of DOH other than some glossy plan that they put out for transitioning to normality or something. And I mean, we're not even remotely close to being at that point. And just to get to that point about what the problem with cases is, I'm going to show you a slide. I showed this actually on the Spotlight Hawaii on Friday, but it's a telling slide. These red dots here are a cross-sectional survey that is done in the United Kingdom of about 10,000 people every week. So they actually go out into the community, they test 10,000 people, and they publish the COVID rates. And then, that gets translated into a population number here on this, basically on this graph. And so you can see, if you take these numbers, which are the real rate, because this is from a cross-sectional sample, and you compare that with what the cases in the UK are showing right now, you see the cases are grossly underestimating what's actually going on. In fact, when we look at the real data, which is the survey data, basically this is the BA2 surge, this was the BA1 surge. The BA2 surge in the UK is now greater than the BA1 surge. In fact, it's peaked and it started to come down now since this graph was made. But this shows you the problem with cases when our testing systems start to fall apart. That's what happened in the UK. It's what's happening in the US right now. So we really can't rely on our cases as reliable trend data any longer. And that's a real problem when we're getting into it. And that's why I prefer now to look at the positivity rate, because even if the number of tests goes down, there may be some biases there. There's going to be a lot less than the biases associated with the changes in the testing system. But I think, that's an important thing to keep in mind, is that our cases are really underestimating the situation at this point. And yeah, we should have a little more attention being paid to this.
And we don't have the surveillance testing system like the UK in place. We don't have this benchmark. But if you look at the data on the chart that you just put up, it is the UK data. The UK data.
Sorry.
Yeah, there. The rates, the surges are proportionate. So we know, and we can pretty much assume that there's probably it's probably underreported. Cases are underreported by actuals by about 4 times. Or right, you're looking at about what, 500,000 cases versus what, 1.5 million.
Yeah, it's just about a factor of 3.
Okay, 3. So we could assume, again, going back to your original comment, based on the number of tests, and from 8,000 to less than 3,000. So we can pretty much safely assume that our cases are over 4,000 cases last week.
Yeah, that gives you a multiplier of like 2.67 just in terms of the case numbers, or the test numbers, I should say. So yeah, so our situation is a lot more than what the cases are showing right now. And the public is completely oblivious. I mean, that's what really worries me.
Well, I got a chance to take a look at the DOH transition plan that was released, and they're very excited about releasing this transition plan. I don't know if you guys got to see it yet. I'm sure you saw it. And they have basically transitioned to what they are calling COVID management, or virus management. Dr. Altenberg, I see you shaking your head. Okay, now I'm not a doctor. I ain't a PhD. I ain't a scientist. I ain't none of that. I am an investigator, so I kind of know how to ask questions. But that's telling me, and correct me if I'm wrong, and let's start with you, Dr. Altenberg. That tells me, the layperson, wow, we're no longer in a pandemic. We are now in management. In other words, and I remember, I'll never forget this. This was profound. This was something Dr. Tim Brown said, I believe it was on Spotlight, or maybe on the morning news one day. He said, living with COVID doesn't mean you ignore it, doesn't mean it doesn't exist. But that transition plan, to me, I have just told the public of Hawaii, the citizens of Hawaii, that we are now going to learn, or we're going to have to live with COVID, And in fact, we are going to manage it when on a virus that we have proven, not just us, New York, so many states and so many countries cannot manage this virus. We are not at a point that we can manage, but the State Department of Health says we are now in that management mode. What are your thoughts, Dr. Altenberg?
Well, what are their managerial tools? The only tool I've heard is that they're going to ask the public to take personal responsibility and to evaluate their own personal risk if they get COVID and act accordingly. So, what are the tools that they propose in this management plan? I haven't read the plan. So,
Okay, well, but that's kind of the message that they sent. I mean, that's basically what I got out of it. And I know we got George White on. I know he probably read it, but uh, Dr. Brown,
I glanced through it. I haven't read it in gory detail, but fundamentally, it seems like more of the same. I don't see anything really new there except for wastewater surveillance that hopefully will come online sometime in the summer. I see no real plan for consistent surveillance that will help us to better understand the actual trends that are occurring. Uh, I don't see a whole lot other than saying we're turning the treatment stuff back over into the healthcare sector, which fills me with great fear, I must say. When we're talking about a treatment where I've got to get it to somebody within 5 days of their testing positive, and not when they're testing positive, their first symptoms, given that there will probably be a 2 or 3 day delay before they finally decide to take their COVID test. They'll already be very well into those 5 days, and then you've got to get an appointment with your doctor. They may or may not require a renal exam from you, which is something that's generally recommended for doing this. I'd say your chances of getting those drugs in about 5 days are probably pretty low, unless you're going to a clinic where they're already set up basically to handle this and they really are doing test and treat. I know that at least one of the clinics that I talk to people at has told me that they applied to be a test and treat clinic several weeks ago, but they've heard bupkis at this point. So no, I don't think we're ready. I don't think, the treatment plans are not in place. If you're uninsured, so I just noticed that and think you're out of luck. Right now, there's no federal money for testing. There's no federal money for treatment. There's no federal money for vaccines. They've stopped reimbursing people for those things. And we know the way the U.S. healthcare system works. If the government ain't going to reimburse them, they ain't going to charge you. You're going to pay for it. And that means, if you make the mistake of going to one of these fly-by-night testing operations that charges $300, you're going to be out $300 from your pocket because there ain't going to be anybody to reimburse you unless you're insured. And there are a lot of people who are uninsured at this point, a lot of people who do not have ready access to a healthcare provider. And the speed with which our systems work are pretty slow comparatively. It takes days sometimes to get an appointment, and hopefully they'll speed that up. They'll find some way to streamline that. But I would really love to see our healthcare providers actually proactively go out there and tell us what they've got planned to make sure that you can get your Paxlovid within 5 days. What's their mechanism? How do you get on the fast track to Paxlovid? There should be a plan coming out of every major healthcare provider in Hawaii that tells their people this is how you get access to this drug. Because these drugs have to be delivered quickly, and for those who are at higher risk, they can reduce hospitalization and death by 90%. So, we got to get them out there, but we're not doing anything to really prepare our systems. And what I saw in the management plan was pretty much, well, we're going back to the private sector.
Well, they basically dropped the responsibility back on the individuals and the healthcare providers. There is really no. You're right, Doc. There is no plan, um, and the healthcare providers are trying to figure it out as well. How are they going to best serve their patients? But you bring up a good point. A couple of points. Number one was the underinsured or uninsured. They are going to be in a world of hurt because they are basically not going to get seen. What's happening now, and I think you can see it in the comments, there's several people that are having problems just getting an appointment to their primary care physician. Just getting an initial appointment is tough because of so many people need care. And then the other problem, which you also highlighted, was the fact that you get a test, you get a PCR test, you got to wait a couple of days to get a result. Um, that 5 day window is so critical, according to all of our medical doctors that we've had on the show, and it's common knowledge now that you need to get that treatment within 5 days. I'm worried that a lot of these guys are going to miss the window because the systems aren't in place, and
Well,
it doesn't
this is
seem.
this is this is where, Mel, what you need to do is you actually need to set up a system.
Yeah.
New York City has done this. Basically, if you test positive on a home test, you can basically consult with the physician through an e-health consultation, and they will actually they will deliver the drugs to you at home. What we really want is we want a system set up where somebody, if they test positive on a home test, can do an e-health consultation with the physician who can assess their medical record and their history, because there are a lot of contraindications for this drug, Paxlovid. Okay, if you're taking other drugs, it's very important you watch for drug interactions. So you do have to see a physician, but that could be done through an e-health consultation with somebody who has your records. And then you've got to get the drugs. Now, we really don't want to be bringing sick people into the healthcare settings if we can avoid it. So
Mhm.
why don't we try to set up a system? Singapore's done this. They set up e-health consultations a long time ago. When what they do with mild cases now is they monitor them at home. You check in with your e-health doc every day or a couple of days. You report your temperature and other information to them on a regular basis, and they basically track you at home. We should be thinking about things like that. They're cheaper, they're safer, and we could guarantee that people could get the drugs within 5 days if we did something along those lines, provided they can get the test in the first place.
Yeah, and I think that's I had lunch the other day with Dr. Capono and Dr. Capono Chong Hansen and Dr. Darrell O'Carroll, and we do have a supply of Paxlovid here on Kauai, so we have the drugs. It's getting the people in time so they can get that treatment and possibly save their life. And again, unless there's we don't know what they're doing because they're not telling us what they're doing. So either they're working on this and not telling us, or they're not working on it, and so there's nothing to tell us. I don't know now.
Well, I think, the other problem is just that, like you say, the information is not getting out there to people. You know, how many people really know about Paxlovid? How many immunocompromised people really know about Evusheld and have access to it? Every immunocompromised person at this point probably should be on Evusheld, which is a monoclonal antibody that is used for COVID prevention. But at the national level, I know we're only using about 20% of what we have available because people don't know about it. So, the other thing I saw missing in that plan was really public education.
Hmm.
Public education about, okay, what's actually going on with the epidemic right now. What we have now is not informing the public about the epidemic at all. Okay, sporadic stories in the newspaper, most of which are from the mainland, don't inform people here in Hawaii about what their situation is. Information about testing. We need simplified instructions on where to get a free test.
Hmm.
And we're told that, the city and county at least will be continuing, here in Honolulu, will be continuing to provide tests at the airport if you want to go to their trailer out there. But, the websites in terms of this are a mess. You need a simple one that just helps you to locate what's the nearest free test to you. Make it very, very easy for people. Okay.
It
Similarly,
has
on
to. It
treatment, get
has.
the information to people on treatment so that they know that the treatments are out there and they know what to ask for. Because if you don't know what to ask for, you ain't going to get it. That's the bottom line.
Yeah. I, it has to be accessible. I mean, whether it's treatment or testing, and that's what now, and that's why you see the drop in testing from 8,000 to 2,000 or whatever it is, because not everyone can drive to the airport. We have kupuna. We have people that don't drive. We have people that have transportation challenges that they cannot or they will not go in traffic to get to the airport to do a test. And again, we spent a lot of money over the pandemic because it was federal money. You hit the nail on the head when you said once the federal money dried up, so did the services. But you look at our COVID management or transition plan, and it kind of mimics or mirrors our tourism management plan, right? There is no management plan. It's since they started managing tourism. I don't know. I see more tourists here. I see more mess here with traffic and everything else. So it's there is no management plan, and the management plan is really it's on your guys' shoulders now, guys. You guys got to be responsible. At the same time, they're telling us to be responsible, and we'll get it. You know, it's a segue to our next discussion. Is we're telling everybody you don't have to wear a mask. You know, we're telling everyone we don't have to mask, especially in airplanes and airports and buses, in trains, in Ubers and Lyfts. You know, I don't know how many people are. I would be frustrated if I was a flight attendant, if I was an Uber driver, a bus driver. All of a sudden, within minutes, right? I started my shift in a somewhat safe environment. I mean, as safe as it could be, with everyone wearing a mask. And within minutes, I'm now in an unsafe environment, and that is quite concerning. I think now, yeah, we're going to file an appeal, and hopefully it'll be, expedited. But can you imagine the confusion if the Supreme Court should overturn the rule that overturned the initial rule? You know, these guys are playing with people's lives, and now, especially for us here in Hawaii, who we have an opportunity to protect our borders, we have a pretty a decent opportunity to at least slow down the variants, new variants from coming in. Now it's wide open. Dr. Lee, what are your thoughts about that? About we are now wide open. It's a como mai COVID. Come on in. Is that
Well,
that a concern?
so there was an article yesterday in the Hawaii News Now, and they quote Brooks Bear of the Department of Health saying that they're looking towards managing COVID in a more traditional manner. So I want to point out that there is no traditional treating pandemics, because the last deadly pandemic we had was the 1918 pandemic, and we're certainly not going to adopt the methods that they have then. So the only kind of tradition we have in dealing with this COVID-19 pandemic are all the measures that we've instituted in the past 2 years. And so we have never we haven't managed the pandemic before without the face mask mandate on public transit, without free public testing availability, and without other federal backup for the treatment. So we're entering right now into non-traditional territory in terms of how you manage a pandemic. It may be traditional in terms of how you manage other viruses like the flu, but not COVID, which is several times more contagious than influenza, many times more contagious. So I wanted to amplify actually on something Tim Brown said about monitoring. Oh, that's the other thing is we've had high resolution monitoring of the cases for these past 2 years, and now that is being dismantled. Can I share the screen?
Yes, sir.
All right, let's see here.
Oh, no, wrong one. Hang on. Oh, where did your shared screen go? Can you try and share it again?
It out. Okay, let's see.
Okay.
Do you see a graph there?
Yes, I do.
All right, there we go. So it turns out if you can fit a formula to the positivity rate to estimate the actual number of cases that are reported, and here's what you get. And this is starting from day 200 of the pandemic going forward. And the blue line is the actual reported case numbers. Okay, and there's our big Omicron surge where it actually blew the top out of the reporting system. And the orange are the predicted values based on the positivity rates. And so you can see that these predicted values, the orange, tracks the blue extremely well. All right, until we get to the overwhelming part of the Omicron surge. And here we are now. And if you notice the end, something funny is going on. The blue and the orange line are splitting apart. So here's a zoom in on that. Okay, so this is the days in the past 76 days of our numbers. And you can see the predicted line based on the positivity rate tracks the actual case numbers very closely until about 35 days ago. And then they start to diverge. So here's the current case. But if we apply the formula to those to the positivity rate, we get these case numbers in the orange. And these are averaging for the past 7 days about 656 cases a day, which puts us in part of the highest part of the entire pandemic so far. And so, if we are if this formula is still valid for the past month, that means we're having a large surge that's completely invisible based on the case data. So I don't know if that formula should be trusted, but that's what it's telling us. If we can positivity rates the way that we have for the whole previous part of the pandemic, it's telling us that in the past week we've had about 650 cases a day and growing.
Well, I mean, is there any reason to believe that the formula wouldn't work in today's with today's virus? I mean, I think if you look at that chart, the orange and the blue are pretty much the same all the way until maybe we stop testing. Maybe our testing reduced, the surveillance testing. Maybe because people are relying on home tests now, which don't get reported to the Department of Health. I mean, is there any reason for us to suspect that the formula would no longer work?
Well, so the drop, the 2/3 drop in the total tests that Dr. Brown brought up, I would like to see how they coincide with the splitting of these graphs. That could be the main explanation of it. And the only thing I would think that would make this formula invalid is if the people that are going to get tests that get recorded by the Department of Health are flooded by people that got positive home tests. All right, that would increase the positivity without necessarily meaning that it's greater numbers in the total population. And unfortunately, there's no data to answer that question. But if this formula is valid, then we are having a really large surge right now that's completely invisible based on the case numbers.
Yeah, and again, I think based on your formula, and again, your formula has been, on track since the beginning of the pandemic. And again, what's a doctor? The other doctor from East West Center, Doctor
Wolf Miller,
Cheetah or no Cheetah, the female doctor that would be on the news. She came on the news a while back. I haven't seen her in a while. I think she's or High Pam. Maybe
She from
oh, yeah.
IBM, yeah.
Professor Monique Sheba in the math department at
Sheba.
UH Manoa.
I remember probably a year and a half ago when she said that math doesn't have a political agenda. She said that the mathematical formulas that we use to not so much project but to estimate where we're heading, those formulas don't have a political agenda. So and as we look at this data, for me, again, not a scientist, but it's pretty clear that the formula was stable for the vast majority of the pandemic. And all of a sudden, but it is also, as an investigator, I look, okay, the testing dropped, then that would make sense. That would make just logical sense that you drop the testing, you drop the cases. But the positivity rate I think, is something that we should be paying more attention to than just the case counts.
Well, I think, the thing that disturbs me is there are other ways to validate this and to check this. You could, for example, look at the hospital testing that is being done. The hospitals are testing everybody who's coming into their facilities typically for any type of procedure. And you could certainly separate those out with respiratory symptoms from those without respiratory symptoms. And again, form a trend from that, and that would give you some idea of what's going on kind of in the background in the population. And the hospitals are doing this. I mean, I've got a surgical procedure next week, and I've got to go in for my COVID test on Monday for that. So, they're there are other sources of data if somebody would actually go out and gather them. And I think part of the problem here is we do not have a proactive group that is interested really in getting to the bottom of what's going on and fully understanding what's happening. And that's a problem when we're telling the public that they have to make the choices, but we're not going to give them any information to make those choices. It's interesting to note, I mean, Lee was saying that we'd be dealing with something on the order of 650 cases. If I just take the 8,000 tests that used to be the norm, 8,000 per day, and I multiply by the 7% positivity we have right now, that would already put you at about 560 cases a day. So I think, our two assessments of where we are right now are pretty similar. And that is that, yeah, we got a lot of cases happening here right now, and there's a lot of transmission going on in the islands, and nobody's paying attention to it. And I think that's a real concern and an issue.
Well, the danger with that, the obvious danger is that you have a lot of infected people that don't know they're infected, and they're going to work, they're going to the stores, they're going on a plane, and spreading this virus. And it's there's a lot of people that actually are going to work sick, and those people are, my son called me today. He's sick, and obviously caught it from a coworker that went to work sick. Those people are selfish, when you go to work and you're sick. And I don't care if it's COVID, I don't care if it's the flu, I don't care if it's diarrhea. If you're sick, stay home, because you don't know who you're going to infect. So now we have this whole thing with the airplane. I know, Doc, you had put up a slide about the airline or the airplane. I think I disappeared. You may have to put it back up.
Okay.
And I do want to spend some time talking uh, about what was just done, the removal of the
Okay,
mask mandates. Did you put it up?
I'm putting it up right now.
Okay.
Like I mentioned in an email I sent you, let's blow a few of these things out of the air, because there are real problems here. The airline industry, of course, is telling us that air travel is perfectly safe, that their ventilation systems are wonderful, and that you don't have a damn thing to worry about if you get on an airplane. Okay? Let's go back to the wonderful days of yesteryear, about 2 years ago, and look at when COVID basically was first introduced to us. Back in, say March to September, October of 2020. Back then, we had a nice little COVID strain, basically derived from the original Wuhan strain that was not that contagious comparatively. Your average person would infect maybe 3 others. The R0 was estimated to be around 3. And, well, you would think, well, with something like that, which is, in the same ballpark as influenza, which is 1.5 to 3, somewhere in that, well, okay. Let's check what happened on aircraft back then with that particular COVID variant. So I've pulled together a few slides for you. These are from some published studies. Okay. Here we go. This is Vietnam Airlines Flight 54. This is the index case, 5K. This is everybody in business class who basically got infected on that flight. And as you know, business class seats are much roomier and much more spacious. You can even see they're separated here than back here in economy. And even some people back in economy got infected on this flight. And this was a 10-hour long flight from London to Hanoi. And, we see a very substantial number of infections occurring here. Okay. The conclusion there was we conclude that the risk for onboard transmission of SARS-CoV-2 during long flights is real and has the potential to cause COVID-19 clusters of substantial size. Now, this was back before masking, which is where we are again now. And they were telling you that, yes, it could still occur on planes. Next flight, Emirates 448 from Dubai to Auckland. Okay, this is a longer flight, 18 hours, 2 minutes on a Boeing 777. And these colored cases, or these colored dots, are the cases. This was actually a fairly empty flight. Notice all these empty seats here. And the 2 index cases are believed to be passengers A and B who are a husband and wife. And then you see a couple people in front of them got infected, this guy up here got infected, a couple people behind them got infected. This is not abnormal for respiratory illnesses on airplanes. In fact, the general guidance from CDC in the past has been that if you do detect something like tuberculosis or something on a plane, that kind of the minimum you should be doing is doing at least 2 rows in front and 2 rows behind, because that's kind of what they assume is kind of the range for a normal respiratory pathogen. So, on this flight, basically at least 4 others got infected. They believe person G here actually got infected during quarantine. Now, why do we know these things? We know these because on these international flights, we put quarantine requirements in place upon arrival. So, for example, when they got to New Zealand, they were in quarantine for 14 days. So if they tested positive, we knew it. And everybody from the flight was in quarantine. So they basically had access to it. That's why we could get this information. Another one. This was a domestic flight of 5-hour duration from Sydney to Perth. An Airbus A330, 241 passengers. And again, in this case, you had a lot of people who were infected from a cruise ship that they had just come off of. Okay? But basically, they infected these blue cases are secondary flight-associated cases. So the red cases are the people coming off the cruise ship for the most part. But then they, in turn, infected all of these people, all the blue ones here. So again, a substantial amount of transmission occurring on a commercial airliner, and this is a 5-hour duration. Now, gee, how long does it take me to get to San Francisco? Oh, 5 hours. Uh-oh. And there was not much mask use here. So these are 3 examples that are well documented in the literature that demonstrate that even with the original variant of COVID, we could still see transmission occurring on aircraft, despite their ventilation systems, despite everything they're telling us. Okay? So this claim that aircraft transmission is rare is not really justified. And in fact, if you think back to the old days before COVID, back when I used to fly, I can tell you that if I was within 2 or 3 seats of some person who was hacking away, by the time I'd get back to Hawaii, at least half the time I'd end up with a cold or an illness of some sort. So respiratory transmission on airlines does occur, absolutely. Now let's consider what's changed. Now the current R0 estimated for these Omicron variants and its kitties are in the range of 15 to 20. Okay, they're 5 or 6 times as infectious as the original variant. So what do you think is going to happen when you put a whole bunch of people without masks on the plane with several other people who are infected with Omicron, even asymptomatically? Because one thing we've learned about Omicron, asymptomatics can transmit just as well as symptomatics. There's not really that much of an advantage to being symptomatic with Omicron if you're trying to infect people, except maybe you cough more, so you spread it a little further. But asymptomatics do a fine job, basically, of transmitting. Okay, so maybe dropping the mask isn't such a bright idea. And this is a rather hilarious headline that came out about a week before the judge basically killed our mask mandate. Airlines that drop mask requirements are now suffering staff shortages due to COVID-19. Gee, who would have thunk? And let's remember, even if the airplane was safe, if that ventilation system really would protect you, you've got to run the gauntlet to get on and off that airplane. Okay? And this is a fellow's son here who basically took a CO2 meter with him on the plane. And this was basically during the boarding process, he was recording the increase in CO2 levels. The increase in CO2 also correlates with the increase, basically it means dead air, because the CO2 is not getting cleared out. And remember, during the boarding process, they've turned off the ventilation generally almost entirely. And if you're lucky, maybe you got a little ground unit that's pumping a little bit of air in, but effectively the ventilation is off. And you can see it grows from 769 when he first gets on up to over 2,000. That means there's a lot of dead air. There's a lot of air that's lingering there where if there are COVID aerosols in that air, your chances of getting infected will go up pretty substantially. And that gauntlet doesn't only include the front part of the aircraft. That gauntlet also includes getting in and out of the airports now because, again, you're no longer required to wear a mask at most of the airports. Okay? So you've got to run this long gauntlet of unmasked people in crowded settings, stand in long lines probably to get onto your plane with no mask. What are the chances you're going to get through that with something that is almost as infectious as measles, if not more infectious than measles, and get onto that plane without potentially running into an infection? And finally, if you're sitting on the tarmac, it can get even worse. Okay, when you're taxiing out, because again, they haven't started the ventilation system within the plane yet, so that's another extended period during which you basically could get infected. And so this shows you what kind of the background readings would normally be, something around 400. And so basically that means we're not getting much air interchange at all because the CO2 is building up so much. And then this is actually a paper that was published back in, I think, 2018 or 2019 that actually looked at basically how the CO2 levels change during the boarding process. You see they go quite high. So again, there is that period during, you've got transmission occurring on the plane, even with the ventilation system on. You basically have to run the gauntlet to get there, both to get on and get off the plane, get through the airport. And if nobody around you is wearing a mask, given what we're seeing right now with these variants, your chances of getting infected are going to be. I would really not recommend people taking flights right now.
Yeah, and unfortunately, we have people that need to travel, even if it's to Oahu, 20 minutes. It doesn't take long to get infected. Flights, they're not in flights. They're pretty cramped, pretty full. So you have kupuna, you have people that need to get to Oahu for medical care, and they're going to be subject to this pretty, what I consider, unsafe environment. That CO2 meter slides that you showed is quite telling, and I cannot imagine how Congress and all of our supposed leaders just really bought into that myth from our airline executives that it was safe. HEPA filters. We have HEPA filters. Really? Why do I still smell farts on the plane? Why do I still smell farts on the plane? If you have filtration and your filtration systems and your air from the atmosphere was coming in, I would not smell a fart that lingers in the air. I mean, come on, guys. It's just it's frustrating, yeah, because like I posted the other day, the lobbyists, they won and the people lost. That judge fell right into the trap, and I'm hoping that she'll be overturned. I don't know how long that'll take. Dr. Altenberg, what are your thoughts on this? I mean, you saw the slides. What are you thinking?
Well, so airlines are the best of the situations. So the federal mask mandate applied to all public transit. So it included buses and trains, and something like 70 a day use public transportation to get to work. I don't know about the distribution of air filtration on, but I doubt that it's as good as on airlines. So all of those people are now confronted with an environment where there's no enforced mask mandate. Now, if I understand the law correctly, locally, the local transit, the state of Hawaii could impose a mask mandate on local public transit, ground transportation, if it was in their political agenda to do so. So there are local remedies if they're taken advantage of. Maybe Dr. Brown has more information on that, but I just, my impression of seeing those few videos where the pilot announced mid-flight that the mask mandate was gone and would not be enforced, and you hear people cheering. It reminded me of a video where a school teacher tells her 6-year-old students that the mask mandate is ending, and they all cheer. It's as though they announced that nobody would have to follow stoplights anymore, and everybody cheered. wow, we don't get stoplight tickets anymore, and we don't have to slow down when the stoplight comes on, and as though that was some kind of wonderful liberation and freedom. It's mistaking the map for the territory. It's mistaking the the um, response to the pandemic for the pandemic itself. And I don't understand how people on a mass basis can make that mistake.
Well, yeah, I have a hard time understanding as well. Um, you know, I saw, and I meant to make a list to put up on the screen, and but I know there's several airports around the country that their whether it was their governor or if it was a local airport, but you're exactly right. We, as a state, we cannot control what the feds allow or not allow on the airplane. But at our airports, which is what I had hoped, how in the world our governor, who stands firm on our school mask mandates, right? Because he thinks that's is very dangerous for our kids to be unmasked. But he will sit down and not say a word and open up our airports. He has the control of the airports. He has, not the mayors, but the governor. The Department of Transportation controls the airport. So you are right. I had expected Governor Ige to say, okay, but considering the threat, considering the rise in cases, considering the new surge that we are going to see, we are not going to lift the mask mandate at the airports. Or for the buses, it would be the mayor. The county buses, city buses, the mayors could step up and said, regardless of what they say, we in our county or our city are going to require masks to be worn for the protection of everyone. But you notice as soon as that thing came out and as soon as the airlines started lifting their mask mandates, all of our local leaders just jumped on the bandwagon and said, and like they were excited to announce that we are no longer going to enforce mask mandates. I think it's irresponsible. I think that, especially since the CDC is saying, "Hang on, we're going to extend it, right? We're going to extend it because we want to assess this a little more." But every single one of our state and local leaders decided to say no, open them up, and I think we're going to pay a price for that. I think we'll see that in a couple of weeks, 3 weeks. We'll see the effects.
Well,
It's kind
given
of
that
scary.
we're a place where we've got 30,000 people coming into the state every day, that a lot of them will probably be getting infected on those airplanes. Yeah, we're going to see an awful lot of this, and I'm really worried. I think you know the country was already approaching a tipping point with BA2. The hope had been that we would luck out as we did with Alpha. Okay, the US actually lucked out with Alpha because while it spread in the UK in the wintertime, by the time it got to most of the US, it basically was coming into the spring. And so the fact that people started spending more time outdoors and so on actually kept our Alpha wave, except for a couple of states in the north like Michigan, it kept our Alpha wave comparatively low. And the hope had been that that might actually be a contributing factor to keeping our BA2 wave comparatively low. But the problem is BA2 is now no longer the king of the hill in terms of infectiousness. Its kiddies basically are running it over with a truck and then backing up over it again. Uh, the mask mandates have been dropped on travel, and that means that if you get onto an airplane, there's a pretty good chance you're going to get infected there. A lot of those people will be asymptomatic. One of the good things about boosters is if you do get infected, they keep your illness either relatively mild or many people even have asymptomatic infections. So that means a lot of infectious people will be out there and they won't even be aware that they're potentially spreading COVID. So I think that, it's going to be an ugly situation, I think. And I think the US is more or less guaranteed a BA2 wave, probably with its siblings, or I should say its children. Those are probably going to produce a wave that's probably as serious as the original Omicron wave. because I think with all these lifting of restrictions and basically getting stupid about COVID, I think we're going to have a lot of problems over the next several months.
Well, it's the perfect storm, right? It's the perfect storm. I mean, you have a surge, and then and as the charts, Dr. Altenberg, you put up that it's kind of, what did you say? It's as or worse than 75% of the different periods of time that this COVID has been around. So we are. This is not minor. This is not a small amount. We're seeing a pretty healthy surge, and can you remember back a couple of years, a year and a half or so, when, I mean, every time we had a little jump in the cases, I mean, we would be freaking out and we'd be concerned and we'd be locking this down and shutting this down. And now it's like, as we start seeing a surge, we start opening up and we start removing restrictions. I think that's a perfect storm for bad things. So
Not
you know,
not only
go
not
ahead,
only
Doc.
removing protections, I won't call them restrictions,
Yeah, protections.
protections,
I'm sorry.
but removing the ability to know what's going on, the testing regime. So we're not only paralyzed, we're also blind in terms of being able to respond.
Well, I am. It's 8 o'clock. The time when I knew the time was going by quick, but I did tell myself I'm going to ask you guys the same question and give you each an opportunity to answer, because and just because I think that we should allow medical experts, epidemiologists, like two of you, to really be a part of the policy decisions as it relates to pandemics. I really do. I think that it should be taken out of the hands of politicians and left in the hands of uh, experts. So I'll toss this out, and we'll start with you, Dr. Altenberg. It'll be easy for Dr. Brown because he'll probably, I would assume, pretty much mirror what you say. But I now appoint you as the leader, Dr. Altenberg. You are the governor for the day, and what would you do, effective immediately, considering what we've talked about tonight? What changes would you do uh, going forward to keep our communities, our kupuna, our KK, and everybody safe? We'll start with you.
So, okay, I should point out first that I'm not an epidemiologist. I'm a population modeler. So Dr. Brown is the epidemiologist here. So I make mathematical models of how population dynamics works. And that's the skill that I've been trying to contribute towards the pandemic efforts in Hawaii. So basically, all right, evolution is my specialty. And this is the thing that's completely absent from the CDC's new guidelines about community levels. All right, they've basically put a blinder on, and the only thing they're looking at is hospitalization rates and whether the hospitals are getting over full or not. Okay, that's only one part of the whole issue. If you made a policy like that for something like HIV, there would be no public health about HIV because nobody goes into the hospital when they first get infected with HIV. It's 10 years later that they get AIDS, all right? And we don't know what happens 10 years later with COVID. We're still trying to figure out what happens 2 years later. So the other things you have to consider are long COVID, all right? And at least 5% of people that get COVID that are fully vaccinated end up with some term health problem as a result of the infection. 5%, that's like Russia. That's a bigger risk than I want to play with, all right? So the other thing is evolution, all right? Every person who gets infected with COVID is a gain of function laboratory, genetic engineering laboratory for the virus, all right? And those labs don't put out anything dangerous, but every single variant of concern came out of somebody who was infected, all right? And so the reason that we're still in a pandemic and it's not endemic is because every variant and its offspring are taking over, as Dr. Brown mentioned, You have BA2.12.2 is now the champion, and it's displacing its parent BA2, and this is not stopped. This treadmill of new variants keeps generating, and that's why the only way to stop that is to stop transmission. And so you have to try transmission as well as just worrying about your hospitals being full. So what would I do as a policy? Um, I would emphasize reducing transmission with the least costly means as possible. So lockdowns are extremely costly. Putting a mask on is almost cost free. So I would definitely reimpose the public indoor mask mandate if I were governor, right? For $1 for a N95 mask, you can just stop transmission. And I would start a public education campaign to get people to be really competent about getting good N95 masks and being competent in how to wear them to completely block transmission. So that a publication, and I would, as Dr. Brown mentioned, the public needs to be informed about the dangers of long COVID. All right. Um, so another thing is that it's not understood that it's a threshold phenomenon. All right. If you get the reproduction number below 1, the cases just keep going down. If they get above 1, then the cases go up. And so there's a threshold there. And all the combined public efforts to stop transmission are what determine that whether you're above the line or below the line, whether you're sinking or swimming. And so combining efforts, so I would use as the major metric, are the case numbers going up or not? So they've been going up for a month. I would say based on that, we should reimpose the indoor mask mandate. Now, Dr. Ashish Jha, the new White House liaison on COVID, has said it's like a raincoat in a rainstorm. All right, so when the rain is coming down, then you put on the raincoat, the mask, and when the rain stops, take off the raincoat, the mask. But what he doesn't point out is when you take off the raincoat, it actually brings back. All right, so this is the problem, that it's not our actions, our protective actions aren't just in response to, but they are part of what is happening in the pandemic. So I would I would do those at the very minimum. And if we can get the reproduction number down and the case numbers to keep dropping, then that will at least help in terms of the local infections. And I would certainly, I mean, the lieutenant governor is trying to get the mask mandate for kids dropped. A lot of people are getting COVID from their kids from the schools, and I would not. I would keep the mask mandate in the schools for now. So those are my low hanging fruit. Those are the cheapest methods that we can use that don't have any cost on the economy and that could only have an economic benefit. So let me stop there.
Exactly, and it's what used to be inconvenient, being wearing the mask, has become not inconvenient anymore. It's not an issue for me, and I think for many people. I mean, some people see it as an inconvenience, as taking away their freedoms, but it isn't such a big deal when you know in your heart that you are protecting yourself and others. So the one thing I wanted to say was, you talked about they're using the hospitalizations. Unfortunately, they're only using the hospitalization numbers of COVID patients. And when we talk about our state's capacity, hospital room capacities, we cannot be judged the same way as Texas or California or anywhere else that have much better access to hospital beds. So yeah, I think it's a fake gauge, that yellow color or whatever the heck it is. Dr. Brown, governor for the day. I'm almost afraid to ask you, but you are now the governor.
Okay. First thing I'd start off with would be a public education campaign to educate people on the things I talked about before, what the actual situation is with COVID in our community, what treatments are available, what's necessary basically to access those treatments, the availability and locations for testing. I would make sure that testing was still free for anybody in Hawaii who needed it. Uh, so that public education campaign would be job one. Second thing, I would instruct the Department of Health basically to come up with a transparent and easily understandable website that allows the public to get clear information about what is happening with COVID in Hawaii. And I would basically want that website front and center, for example, on the Department of Health website so that people can get to it very, very easily. They don't even have to go searching or digging down to get that. COVID is still a pandemic. It should be a top priority for the Department of Health at this point in time. That'd be my second thing. Third thing, I agree with Dr. Altenberg. I would reimpose the mask mandate. It just makes sense at this point when you've got an extremely contagious variant out in the community. Fourth thing, I would instruct every healthcare provider in Hawaii that they are immediately required to track down and offer a booster to any of their patients who have not yet been offered a booster. Can't force them to take it, but a lot of them, if we reach out to them, we will get them to come in and take that booster. With Omicron, the booster makes a difference. It radically reduces the amount of hospitalization and death related. When you're 2 doses, when you're far enough out, you've only got about 60% protection against hospitalization. Okay, that can be brought back up into the 90% levels with boosters. So those boosters are absolutely critical, and our healthcare providers should be proactive about doing that. Enough of this sit on your hands and wait for people to come to you. Go to the people and reach out to them. I think I would also instruct them that they have to make clear information available to all of the people that they serve about how to access Paxlovid, what is required, what their prioritization scheme is, because there are limits on Paxlovid. It can't be given to just anybody. There are certain requirements such as age, medical condition, and so on. Make sure that all of that is transparently apparent to people and that they know. I would also require that they institute a test and treat program that guarantees that any person can get a test within 1 day, basically, of accessing their healthcare provider and be put on treatment immediately upon that test being found positive. I think those are kind of the minimum things that I would do as governor if you put me in for a day. It would be a very busy day.
Yeah, and you'd only last a day, so that's all. But that's why we would do it just for a day. You would be impeached right after that, but that's okay. I agree. I agree, and I think the one thing that I would really want to see, and which I'm very surprised that the legislature isn't getting on the state for going back to the daily reporting. I think that is critical. I think people need to see the daily reporting, daily increases, just so they get a better understanding and a realistic understanding of how much this variant is spreading. I think going to the weekly testing, I think a lot of it's just out of sight, out of mind. And then when you look at what's going on with concerts and football games and everything else, uh, we are we are uh, we are playing with fire. I guess is what I'm trying to say. We are playing with fire, and unless COVID has touched you personally or a loved one, I think most people today, if you were to take a survey of all our people in Hawaii right now, a real survey, I think you would find that the majority of people believe that the threat of COVID has decreased to a point where they can do what they want. I believe that, and that's the scary thing. So anyway, docs, I know I appreciate you guys. We're 15 minutes longer than we should be. I wish I could keep you guys here for a couple hours, but I want to respect you guys' time and appreciate you guys coming on. I just want to say this: we don't, what we need some of these protections put back. I like that, protections versus restrictions. But we don't need a mask mandate to practice aloha and respect. I think that's my message to everybody. We don't need a mandate. We don't need the governor to come on and pass a law that you got to take off your slippers or your shoes before you go in someone's home. We don't need a mandate that says you cannot light a cigarette when you jump in your mom's car or your sister's car, right? We take off our shoes because we respect the owners of the home. We don't light up a cigarette in a car because we respect the people that we're going to be riding with. So you don't need a mandate, right? You just got to have that aloha and that respect, knowing that if you take off your mask in an airplane, you have a chance to pick up a virus or spread a virus to somebody that you may know or may not know that may possibly end their life. How difficult is that? So that's my message. Unless you folks have any other closing thoughts, feel free. We got you guys.
I just want to say, following up on what you said, Mel, I think that is the whole problem. That we are now trying to individualize what is in fact a public health problem. And a public health problem, by its very definition, requires a collective effort. It does not require a set of individual efforts. All of us need to do what's necessary to basically protect the most vulnerable members of our community. And that means, like you say, just wear a mask. It's not that difficult. It's not that much of a problem. And what our public officials should be doing at this point is just helping to enable people to take those steps appropriately. And I think that's the real issue right now. But really, let's get back to a collective response and get away from this American individualism that the only one I'm responsible for is me. I'm responsible for my entire community. That is my responsibility. Oops, think you're muted, Mel.
Yeah, I remember when that's how it was. I remember a time when that's how it was. Man, we went through a hurricane. We saw it firsthand, and it seems that we've kind of lost that. Dr. Lee, anything?
I think we should realize that the SARS-CoV-2 virus as a pandemic is a real scoundrel. All right, and it's been able to exploit the weaknesses in the society to propagate itself. So one of those is that it's invisible. All right. The other is that it spreads asymptomatically, and like half of the cases got it from somebody who didn't even have symptoms. And another is that a lot of people don't have large symptoms. So it allows people to go into denial, all right, about the danger of the virus. So if it was killing 20% of the people the way the MERS did, it would be a lot harder for people to go into denial about it and call it a cold or call it the flu. But the mortality rate is low enough that that I think we need to recognize that there's a large portion of the population and a large habit in the culture of denial, all right, of basically picking a side and then choosing the facts that support your argument instead of saying what's really going on here and I want to deal with it. And I think, this is our response to this pandemic is, I think, a trial run for the whole problem of our destruction of the climate. And the United States has fared very poorly on any kind of grade scale in terms of the overall number of people who have died. 1 out of 300 Americans have died from COVID. And I think we have to recognize that it's a manifestation of the total society and the total culture in the United States. And we have to ask ourselves, all right, when we see a response, when we see somebody analyzing, when we see an editorial, we have to ask ourselves, is this part of the problem that has led to so many deaths in the United States, or is this part of the solution? And I think we have to start asking ourselves, what is it that's going on in our society that has led to such a failure? And because it's not going to be the only place that such failures crop up. And I think we need to have a cultural renewal of consideration for each other and of just, frankly, just dealing with reality, of facing reality, seeking out to know what reality is, and then trying to be as excellent as we can in coping with it and dealing with it going forward. And so these are, I think, bigger lessons that the pandemic has to teach us. Um, so I'll conclude with that on a general note.
Wow, what a great show, guys. Appreciate you folks again. I think our viewers got fed some good information, and while not all may agree, um, I think the fact of the matter is this virus is dangerous. It does kill, and we got to stop it. And like you said, the government is we have been a reactionary government, right? We have reacted to COVID. We send out, I don't know how many millions of test kits, right? But we haven't sent out N95 masks, or we have, but we're not making it readily available to our people. Wouldn't you rather prevent the virus with a mask versus giving a guy a test to find out that he has COVID? Now he becomes a statistic. I mean, I think we should be focused on prevention. That's why I think the mask mandates, as you talked about the indoor mask mandates, well, I make more enemies when I say this. That's the reality. You cannot get rid of your addiction, whether it's alcohol or drugs or whatever it may be, until you accept the fact that you have a problem, right? This state has not accepted the fact that we have a problem, and we, as citizens of this great state, will pay the price. So with that, Docs, again, thank you, folks. Stay safe. God bless. To the village, we appreciate you guys for hanging in there. Hope you guys enjoyed the show. We'll see you guys Friday night.
Mahalo, Mel.
Thank you.